When I entered the Ayeduase Health Center, I almost lost my way. The reason is because no one was here. I could cite nobody. So I started shouting and asking for who was around until I met a lady who later said she is a physician assistant and she has been the one taking care of all the patients who have been coming in. Ordinarily, at this particular facility, you'd find people seated at this side of the OPD, which is the waiting area. But because of the strike action, just as you can see, the place is as empty. These people you see here are workers of the laboratory. And so they have no choice but to be at the facility, although they have no nurses to work with. We caught up with the physician assistant, Joanna Awoche, who has been the only person attending to patients performing duties of nurses. And she says the situation has been very, very frustrating.
My work is to see patients, do physical examination, do investigation and treat. But now that the nurses are on strike, I have to take vitals, do drug administration and all that by myself. But because the nurses are not here, I have to wait, like if I admit cases and I give medication, I have to wait till the medication is finished before I can go home. Then when I come in, there are wounds to dress to. I have to do wound dressing, do dusting, everything by myself. So it's quite a problem.
According to Joanna Awoche, who is the physician assistant, she has extended her work time. Instead of closing at 4 p.m. as usual, she can now wait, taking care of patients, extending the time till over 7 p.m. And that is because, according to her, she could not just sit aloof whilst emergency cases troop into the center.
And also, I'm supposed to close at 4 p.m. But because of the strike, sometimes I go home around 7, 8 o'clock, thereabouts. When I close at 4 p.m., the nurses have to take over. They run shifts. So if there is any case that will need my attention, they will call me at home to do consultation and all that. But because the nurses are not around, at 5 p.m. we close and the security man here will close the door.
Well, this emptiness and lack of order have extended beyond hospitals and medical centers. When you get to nursing training colleges in the Ashanti region, students are sitting in class with no instruction and no purpose, as their tutors, who are midwives and nurses and members of the GRNMA, have also joined the strike action.
This strike is having a lot of impacts. Like the disadvantages of it is very high, because we are writing midterm, I think, next week. And then our tutors were supposed to be in class this week to take us through some of the subjects. But we've been in class since morning and no teacher has been around. We are just here. We don't know what to do. We don't know whether to go home or what. Because being in school without a teacher coming to the class or something is something else. Though we can study on our own, but that one will be different from a teacher being in front of us and directing us.
It's easily verifiable how the strike action has impacted hospitals and even nurse training centers in the region. And Joy News will be on grounds to pick up any updates as and when it drops. My name is Clinton Yabua for Joy News.